Hello, 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 ageless bells and bows. It is Dr. Mia at Me Bella Wellness Center. Today, we're going to talk a little bit about contraception options. And for those of you who may not know me, I'm Dr. Mia, your B3 specialist and board certified gynecologist at Me Bella Wellness Center, where we offer gynecology to women and adolescents, as well as total wellness solutions for both men and women. Our goal is to help you live well, age well, and experience everlasting intimacy. So we're going to talk about contraception because I get this question all the time about what are the contraceptive options. So let's start with the very basic. So the first probably birth control or contraception was the birth control pill. The birth control pill can have estrogen and progesterone in it, or just plain old progesterone. Anytime you have a uterus, if it has estrogen, you have to have progesterone, but there is an option to do the progesterone only. For women who have a history of uncontrolled high blood pressure, if they're over 35 and they still smoke cigarettes, of course, if they've had any kind of breast cancer or any kind of blood clot, they should not use estrogen in their birth control. So the safer option would be a progesterone only birth control if you have a history of a blood clot, uncontrolled blood pressure, heart disease, and if you have had breast cancer or any hormonal cancer, you should not use estrogen or progesterone. I like to start with the pills for my mature patients. So a lot of my younger patients who take a pill every day anyway for like ADD or for something, it's easy to put them on the pills because they can usually just take the two pills together. But for the average younger person, they may not remember to take a pill every day. So what I usually recommend for them is something a little bit more long-term, like either a NuvaRing that can go in vaginally for 3 weeks and you take it out for a week, your cycle comes, or a patch that you can use a week at a time for 3 weeks straight. And then the third patch, after it's been on for a week, you take that one off, your cycle comes that week, and you start over with 3 new patches for the next month. Those are some easy options for people who cannot remember to take a pill every single day. The biggest thing about combination birth control, which the NuvaRing has estrogen and progesterone, the Zulane patch or the birth control patch has estrogen and progesterone, as well as the birth control pill having estrogen and progesterone. What those things do for you is, one, they have shown to decrease your risk of ovarian and endometrial cancer, for one. Two, they are going to make your cycles usually lighter, more predictable, and fewer cramps, and usually for fewer days. So it works, the birth control works really well for those young people who have severe cramps during their cycle. So those are some kind of short-term, every day to every week to once a month birth control options. When we talk about other progesterone-only birth control, that can be a depot shot. It's not necessarily my favorite. For my really thin young ladies who don't have a problem with weight or eating, that's a good option for them, especially if they have like endometriosis or severe cramps during their cycles, because the depot or progesterone only shot that lasts for 3 months actually can suppress the cycle. So those people who have severe painful cycles or really heavy cycles, that's a good option, as long as they have good control of their weight, because it can increase your appetite and cause more weight gain. If you do well with the depot shot, you also can do well with what we call the Nexplanon, and that is a 3-year device that goes in the arm, and it's progesterone only as well. And it works similar to depot shot, except for you only need to replace it every 3 years. And then finally, we do have some intrauterine devices that are great for birth control. So my favorite intrauterine device is the Liletta or the Mirena. So that's the highest dose progesterone intrauterine device. And the reason I like that, especially for my young ladies getting ready to go off to college, I like for them to get it usually around their senior year. We put it in the office. So it's an actual procedure where I have to put the speculum in, and I put the intrauterine device through their cervix, and it sits in the uterus. The strings hang out of the cervix, and some they can feel and make sure that they're there. But the reason I prefer that for my women who are older and need birth control, and for my women who are younger and getting ready to go off to college, is because it controls cycles. Some women don't have cycles at all, so it helps with the amount of bleeding, the frequency of bleeding. It helps with cramps. It's really good for women who have fibroids and need to decrease the bleeding. But it also is one of the forms of birth control that's shown to protect the tube. So if you were exposed to chlamydia or gonorrhea, it decreases the chance of that getting to the tubes and causing pelvic inflammatory disease, which can actually cause infertility in the future and can actually make you very sick during the time, especially with an intrauterine device in. So that's why I really like the intrauterine device. The intrauterine devices, depending on which one you get, last from 3 to 8 years now. And we also have a non-hormonal, so no hormones at all, the Paragard copper IUD, which can last anywhere from 10 to 12 years. In some countries it's 12. I'm not sure if we're saying 12 yet in the United States, but those are some of my favorite forms of contraception. Contraception meaning to make sure you don't get pregnant when you don't want to. But we also use all of these medications to help with abnormal bleeding, fibroids, endometriosis, pelvic pain, severe dysmenorrhea, or cramps during your cycles. And for those women who just don't want to deal with the cycle, like for me, I use the NuvaRing. I use it continuously. I built up to that. So instead of taking it out for a week and letting my cycle come, I just used it for 30 days at a time, take it out and put a new one in because I don't have time for cycles because I have too much PMS. So with a lot of the birth control, you can manipulate your cycles. You make sure you talk to your doctor about doing it so you can do it correctly. And usually you don't want to start off doing that with your pills. You want to build up to it. So for me, with the NuvaRing, I started off just skipping a month, letting my cycle come the next month. Then I tried 2 months, but I had been on the NuvaRing for a while. So you can skip cycles. Like if you know you're about to go on vacation and your cycle is going to come that week, instead of letting your cycle come, you can just leave the NuvaRing in, or you can put an extra patch on instead of letting your cycle come. And then with the pills, you can go straight to the next pack of pills instead of using the last week of pills. So it is Dr. Mia at Me Bella Wellness Center. A lot of my patients have questions about birth control, so that's all the information. And a lot of my parents have children or adolescents who are getting to the age where they need birth control. And again, if your daughter is missing school or work because of her cycles, you may want to consider hormonal contraception to help them control their cycles so that they're not bothered and by severe cramps, heavy bleeding, and all of the things that can go on with a terrible cycle. So it's Dr. Mia at Me Bella Wellness Center. Share this with a friend. Make sure you join Ageless Bells and Bows with Dr. Mia and Joseph so that you can stay in the community. And I hope you have a fabulous day. And please share all this great information. Bye. It's Dr. Mia.